Hi, this presentation with exercise, etc. is titled Comprehensive Recovery Strategies. And my name is Laura Abbott. I'm going to be your presenter today. So just to give you a little background on me, if you haven't had me before, I teach at Georgia State University. I have a master's degree in sports medicine. I'm also a licensed massage therapist and teach in the undergraduate exercise science program here at Georgia State University. And the rest of the stuff you can kind of read on your own if you so desire. What this particular slide that's up, you don't need to write all this stuff down just yet. I'm going to show this at the end of the presentation. But just to let you know that you will be able to get your continuing education certificate at the end of this presentation. And this last little note right down here, I just wanted to, wow, that really highlighted there. I just wanted to kind of present this information here is the WebEx program records when you log on and when you log off. So I will try to make this as exciting and interesting for you as possible. But if you do log off early or fast forward through the program, you may be denied your continuing education credits. I don't know how the system does it, but it does track it somehow. So just be aware of that. And without further ado, let's go ahead and get into this comprehensive recovery lecture here. So with the no pain, no gain, basically athletes have off seasons to recover. We all probably know that already. And they train hard when appropriate, but they understand the importance of recovery. And sometimes our general population does not understand that. And my little go-to statement that I say to people is rest is not a bad four-letter word. It needs to be part of the program. You want to push as hard as you can, but you can't push hard all the time. And we all know that. And trying to communicate that to our clients can be a challenge sometimes. But we do need to make sure that as fitness experts, athletic trainers, PTs, whatever your area is, that we need to include it at the rest as a part of the program. Muscles are torn in the gym, fed in the kitchen, and built in bed. So this just sums it up perfectly right here, that it's not a bad thing if you don't use and abuse it, just like anything else in life. Too much of a good thing is not a good thing. So people who rest constantly, well, they're sedentary, obviously. But as a part of your program, we know that we do have to rest. So we should put it into the program as a part of the planned program design. Trainers, of course, those of you guys who are trainers know that the signs of overtraining or under recovery. Your cardinal sign for overtraining is typically the resting heart rate starts to increase. There are a lot of other signs and symptoms, and knowing your client is very beneficial, obviously, but looking at their mental health as well, as if they're starting to not enjoy the things that they normally enjoy, that may be a sign that they need to have a rest day or a couple of rest days. But one of your best indicators is to check that resting heart rate. And if that resting heart rate is increasing and staying increased over several days or several weeks, that's a sign that that person's probably overtraining. And the body's responding, of course, by increasing the heart rate because of the stress that's involved. We know, like I mentioned, professional athletes have an off season, and I always find it very interesting. I've been in this field for many, 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 many years, and it's amazing what the general population thinks that they can do for a workout. That, they read these magazines and they say, oh, this international athlete is doing this program. Well, by golly, I can do it too. And it's like, no, you can't do that program, which is why you're not at the caliber of the person that you're reading about in this magazine. But a lot of times people think, well, if professionals can push hard and train hard and take time off to recover, well, if I don't take time to recover, I'm going to get better and faster. And of course, we know that is very, very, very untrue. So we tend to be so focused in the fitness industry of what exercises you should do, your cardio program, your strength program, even your flexibility program, but we tend to miss the recovery part. And we, like I said earlier, we really do need to incorporate recovery and rest as a part of that program design. So, well, what is recovery? Well, recovery is a return to a normal state of health, mind, or strength, actually. Your basic principle of training with two primary roles is to monitor the athlete or client's adaptation to training and stress, and selection of specific recovery techniques to minimize fatigue from training. And one of the things that we need to remind ourselves of is as we get older, it tends to take us a little longer to recover. So it's not necessarily that we need to add in more rest. We may need to add in recovery days, where maybe the person was doing higher impact type activities on Monday and they can do something lower impact on Tuesday. So that's one way that we can kind of help people to recover. But the difference between recovery and regeneration is, like I mentioned, recovery is a return to a normal state of health, mind, and or strength. Regeneration is the action or process of regenerating or being regenerated, which is a part of the recovery process. So with recovery, the fundamental element that's critical to the recovery process is sleep and nutrition. And how many of us in the fitness industry have seen people compensate one in order to, in their mind, improve the other, especially when it comes to nutrition and exercise? We see it all the time. People who are trying to lose weight, so they follow this regimented exercise program, but their nutrition program is designed to set them up to fail. So these all go in hand, and the one area that we tend to not focus on much in the fitness industry is sleep. So we need to talk to our clients about that as well. You're under recovery. This is a state in which a lack of adequate recovery creates unfavorable psychological, physiological, and performance outcomes. So it's easy to see it in your athletes where, like we said, they're losing passion for a sport that they once loved. Their physiological change is that they're not performing at the caliber that they were, a month ago or a couple of months ago. And their body's responding in a negative way, maybe with getting sick more injuries, you name it. With our exercise clients, we don't always see that aspect of it. And it could be things that we may kind of not pay attention to, such as comments that the client may make that work is getting harder, work is getting more stressful. Well, yeah, okay, sometimes that happens with work, but could it also be that you're not sleeping well at night because you're overtraining and your body is in this constant fight or flight syndrome, and because you're not getting the rest that you need, it's starting to affect your work day? So sometimes we get these little subtle messages as fitness professionals, but we don't always tie them into, gee, are they doing too much for their exercise program? Or, what else is going on? So controlling fatigue and recovery. The autonomic nervous system breaks down into two categories. There's the parasympathetic nervous system and the sympathetic nervous system. And I always remember the parasympathetic nervous system is the one that helps us to slow down, like a parachute. So you've got the parasympathetic and the parachute. Helps to kind of, bring us back down to resting levels, whether it's from exercise or stress or whatever. The parasympathetic nervous system helps us to relax a little bit. The sympathetic nervous system is the excitability part. It's the fight or flight. Activity of the sympathetic nervous system leads to an increase in heart rate, blood pressure, secretion of catecholamines, cortisol, and other chemicals in a reaction to stress. Now, there are times when that's a good thing, such as when we're exercising. such as when we're excited about something, and even when we're nervous or stressed about something. But it's when it's constantly being triggered that it starts to wear the body down. So the opposite of that, of course, being the parasympathetic nervous system, it inhibits. The PNS system inhibits. So it's responsible for the rest and digest, or some people say feed and breed. It helps to stimulate activities during rest, such as eating and digestion, in order for us to get the nutrients that we need to recover. Salivation, urination, defecation. So it helps us to get the nutrients that we need, but it helps us to excrete the things that we don't need. And when that is limited in use because the sympathetic nervous system is constantly in effect, it just, like I said, it starts to wear and tear on the body. Later in this workshop, we'll review methods of increasing parasympathetic activity to help in the recovery and regeneration process. But your sympathetic and parasympathetic nervous system, it's a multi-level interaction between the two. So in order to allow precise regulation of body functions, the activity of the autonomic nervous system must be precisely regulated. The traditional model concerning the regulation of norepinephrine and acetylcholine release in target tissues suggests that the activity of the efferent arms of the autonomic nervous system are more or less independent of each other. However, plenty of experimental and clinical studies have demonstrated the presence of multiple interactions between the sympathetic and the parasympathetic nervous system, and they're mediated through several little pathways and mechanisms at both the central and peripheral levels of the nervous system. So brain, the cranial nerves, the spinal nerves, all of that ties in with this. So interactions within the central nervous system are mediated predominantly by neurons within the nucleus of the solitary tract and the paraventricular hypothalamic nucleus, which is in the brain. The peripheral interactions are based on morphological functional organization of the sympathetic and parasympathetic pathways that are at the sympathetic prevertebral ganglia, the neuroeffector connections, if all of that rings a bell with your physiology. So alterations in these interactions between the sympathetic and the parasympathetic nervous system can lead to an unbalanced autonomic activities, meaning we're kicking in the sympathetic nervous system too much and the parasympathetic system not enough. So we're not getting that rest, relax, feed and breed, whatever you want to call it. That's just not happening. And that can influence the development of a host of disorders such as cardiovascular disease, inflammation, and not just inflammation of your joints and your muscles, but inflammation of your blood vessels, which we know that inflammation of the blood vessels is a key factor that can lead to heart disease. Metabolic problems, thyroid problems, diabetes, neurological, and your psychiatric diseases. So there is a whole host, like we said, just multi-level interaction that it just kind of domino effect, that if we don't allow ourselves to have the rest that we need, we're going to have this domino effect leading to all these diseases and disorders that don't have to happen. So your stimulus and recovery, this has come out of the book by David Joyce in 2014 is when it was published, and it's called High Performance Training for Sport. So this kind of gives you an idea of recovery time for various workouts. So if you're looking at acute training stress, your standard fatigue, you may need 24 to 48 hours rest. If you have somebody who's unaccustomed to exercise, then they may need to start out with 3 to 5 days of recovery time. So, American College of Sports Medicine talks about 3 to 5 days of cardio workout or 2 to 3 days per week of strength training. And I tell my students over and over and over again, your beginners need to stay at the low end of that range. If they haven't exercised in years or have never exercised at all, we would love to get them up to 5 days. But that's not where they need to start because they need some time to recover. This is a new stimulus to their body, and their body has to gradually adjust to it. If we start telling them, hey, let's go gung ho, like so many people do on January 1st because it's a New Year's resolution, then they're going to end up getting injured. And that is why we see the high number of dropouts for exercise. 50% of your beginner exercisers will drop out within 6 months, and a lot of it is injury related. There are other factors as well. But just because a book says 3 to 5 days per week for your workout doesn't mean everybody needs to start at that. And your beginners, people who are not accustomed to exercise, they need to start off at the low end of that range so that they can incorporate 3 to 5 days of rest in order to give their bodies that time to adjust. Now, training overload or overload fatigue, 5 to days within a reduction of the training load for recovery time. And again, you're thinking, well, wait, that's like a week off. We're not saying complete rest. We're saying alternate with some other activities that give those areas that you just overloaded a little bit of a break. Excessive training, 2 weeks with a reduction in training load. And again, reduction, not elimination, but reduction in the training load. Short-term overreaching, long-term overreaching, and these may be your athletes that are getting into their seasons where they've had their preseason training and now they're competing. They may need 1 month or longer for a reduction in training load. And we see this for those of you who are familiar with working with athletes who do compete a lot, that your athletes tend to pick that one event or that one race where they really want to do well. And they may do what's called tapering. And tapering means that they're still training, but they're kind of backing off a little bit right before that big event so that they can have the time that they need to let their body rest and recover without getting out of shape, but just declining or reducing their training load so that they're 100% rested and can go for that personal record or that personal best for that one race or one event. Athletes do that all the time. And you may have clients for the fitness professionals who, maybe they're in cycling or they want to run a road race and it's the big race of the year. And that's the race that they have chosen to be their big, hey, let's go for the personal best or the personal record. And that involves your recovery time or tapering time that they've worked hard for this many months. Now they're still working out, but they're declining or reducing their training in order to get some rest. So that's kind of what this slide is talking about here. So looking at sleep and the autonomic nervous system. Sleep is a challenge for a lot of people. We know that, but it's the most important component in the recovery process because we know that that's also when the body rejuvenates and recovers. Without it, the body never gets to recover. Unfortunately, though, we are in a quick pace, immediate response society. And that a lot of times when people think that they're tired, oh, let's replace sleep with coffee, get some caffeine. Let's do something else instead of sleep to keep me going. And at some point in time, your body's just going to rebel with that. So an argument for sleep being more important than nutrition for recovery is the fact that sleep deprivation leads to inefficient glucose metabolism. During the waking hours, the brain will need glucose to function properly and stimulate sugar cravings. The person will eat more carbs but not be able to metabolize the sugar properly, leading to more cravings. So we can tell our clients to eat less sugar all we want, but if they're not getting enough sleep, we're never going to win that battle. They've got to get the sleep. So we know that sleep deprivation increases the sympathetic nervous activity, the fight or flight. It leads to delayed visual and auditory reaction time. It reduces endurance performance. It impairs motor function, increased levels of fatigue. So it's the snowball effect that happens where the person's trying to train harder, but they're exhausted and their brain isn't working properly, so they can't remember plays or patterns or they're just, and it's a catch-22. They think, oh, I need to train harder. I need to practice more. No, what you may need to do is sleep. We just mentioned the decreased glucose metabolism and then suppressed immune system response. And we know that last one, gosh, I mean, how many times have we seen that where people are constantly getting sick and you're like, what the heck is going on that you're constantly getting colds and, this, that, and the other thing? And it could be that they're just not getting enough sleep and their body can't recover. So sleep and performance. Think of a child that has not had a nap. If you have kids, you can relate to the change in their mood and behavior. So we need to make sure that we've got that sleep. So naps are not a bad thing. So we need to make up some of the sleep debt. And there's actually some articles that I'm going to go over with you that talk about getting extra sleep and how extra sleep can improve athletic performance. Extended sleep time leads to faster sprint times in these studies. It found there was an improved reaction time, reported decrease of fatigue, improved mood. I mean, think about how you feel when you get up from a nap. But there is study after study that's showing that extending your sleep for some people in studies with swimmers, and this study in particular was done on Stanford swimmers, to improve their 15-meter sprint time, their reaction times, and the turn times, for their flip turns and turns, for a variety of strokes, and their kicking strokes. So what they found, participants in this study, and it's a small group, there was 5 healthy students. But it's something that you could try for yourself too if you wanted to. In fact, you might be taking a nap right now. But 5 healthy students on the Stanford University men's and women's swim teams. And for the first 2 weeks of the study, the students maintained their usual sleep-wake pattern. The athletes then extended their sleep to 10 hours per day for 6 to 7 weeks. The athletic performance was assessed after each regularly scheduled swim practice, and after obtaining extra sleep, athletes swam a 15-meter sprint 0.51 seconds faster, which doesn't sound like a lot, but it really is in a 15-meter sprint. Their reaction time improved by 15.15 seconds, quicker off the starting blocks, improved turn time by 0.1 seconds, and increased kick strokes by 5 kicks. And again, these numbers sound so small, but if you're an athlete, a swimmer, whatever sport you played, you know that races are won by hundredths of a second. So this could make or break first place versus you're out of medical contention. So the results began to kind of show the importance of sleep on athletic performance, and more specifically, how sleep is a significant factor in helping athletes to achieve peak athletic performance. So the study focused specifically on collegiate swimmers. It agrees with data from other studies that these researchers have done that suggest that athletes across all sports can greatly benefit from extra sleep and gain the additional competitive edge to perform at their highest level. The study also monitored daytime sleepiness and weekly changes in mood. The daytime sleepiness decreased significantly with extra sleep, while mood improvements related to getting extra sleep included higher ratings of vigor and lower ratings of fatigue. So typically, a lot of your athletes accumulate large sleep debt, especially your student athletes, by not obtaining their individual sleep requirement each night. And of course, this can have a detrimental effect on cognitive function. And again, the study's focusing on student athletes, so cognitive function in the classroom, that can be a challenge. And that can cause students to perform poorly in school, possibly lose their scholarships. I mean, that it just snowballs. But their cognitive function improved. Their mood and their reaction time. So these negative effects can be minimized or even eliminated by prioritizing sleep in general. And more specifically, obtaining extra sleep to reduce one's sleep debt. And for years we would always hear, you can't make up lost sleep. Well, new studies are showing that, yeah, maybe we can. So the researchers in the study reported similar results in a previous study of 6 players on the Stanford men's basketball team. Performance measures such as sprint times and free throw shooting improved after extra sleep, as also did the mood and the alertness of the athletes. So many of the Stanford coaches are definitely more aware of the importance of their sleep. So we all should be kind of paying attention to these articles. Coaches at the school have even started to make changes to their practice and travel schedules to allow for more proper sleep habits. And for many athletes and coaches, this study was really the first time they truly understood how large of an impact sleep can have on their performance. So some tips that the researchers recommended to these athletes and passing along to you guys is make sleep a part of your regular training regimen. Extend nightly sleep for several weeks to reduce your sleep debt before competition. Maintain a low sleep debt by obtaining a sufficient amount of nightly sleep, like 7 to 8 hours for adults, 9 or more for teens and young adults. Keep a regular sleep-wake schedule. And that can be a challenge, but people just have to try to make the effort by trying to go to bed and waking up at the same time each day, even on the weekends. And then take brief naps to obtain additional sleep during the day, especially if you're drowsy. Like we said, naps are not a bad thing. Naps are awesome. Some other studies also show the same thing, where, again, at Stanford, they're just sleepy people out there, I guess, looking at the effects of sleep extension on athletic performance with the basketball players, which we actually just mentioned. But the subjects maintained their habitual sleep-wake schedule for 2 to 4 weeks for a baseline. And then they followed by a 5 to 7 week sleep extension period. And by obtaining as much as 10 hours a night of sleep, that helped improve their performance for basketball. So, again, and hopefully in the classroom, being an educator, so sleep is important. These studies are showing that sleep is very important. So how much sleep is enough? That's usually the next question that people ask. Well, how much should I get? Well, unfortunately, it's going to be different for everyone, so we can't give people a number. But we should try to strive for 8 hours. Some people need a little bit more than that. Some people need a little less than that. It's really basically trying at least 8 hours, trying to get up at the same time each morning, like we mentioned, trying to go to bed at the same time, trying that for at least a couple of weeks and listen to your body and see if you're seeing some improvements, or if you're still a little tired or foggy or, whatever your symptoms are, then play around with those times. Shorten them, lengthen them, whatever. Napping can help with some sleep debt. I know people that go to bed, at whatever time, and they get up really early in the morning because that's the only time sometimes that they can squeeze in their workout. But then when they're done with their workout and showering, I know a couple of people that actually go back and take a little nap, and that works for them. And that's what you got to try to find, is what works for you. And then just use some simple strategies to improve your sleep. Well, what are those strategies? Look at that. Next slide. So tips for improving sleep. Ask the right questions. Ask them, what do you do right before you go to bed? I know for me personally, the last thing I can do, if I'm going to stay up all night, watching the news is the way to do it. So I had to make myself stop watching the news at night because, it's all that bad stuff. Computers, anything with artificial light, but a lot of times people are on their phones or their iPads or their computers, electronics, tablets, whatever. And if you can get yourself to say, at such and such a time, I'm off my computer, I'm off my phone, I'm, off my Kindle. That's one of the challenges that I just read a study fairly recently that said that reading actual books instead of reading these books online, Holding the book in your hand and reading it actually helps you to relax more because it's not an artificial light. I mean, we all love technology, but sometimes technology does not love us. So these people who go out and buy these Kindles or these readers, these iReaders, or whatever it is they're using because they can immediately download a book, may actually be affecting their sleep. Like we mentioned, try to go to bed at the same time every day, and that includes the weekends. I know a lot of us want to sleep late on the weekends, but sometimes it just doesn't work for us to sleep late on the weekends, and then you're lying in bed Sunday night and you can't fall asleep, and you start stressing out because you've got to go to work the next day. So keep it consistent. Reducing your caffeine, and it's not just caffeine drinks, it's caffeine in your foods, which we'll talk about some nutrition things in a little bit. And exercise earlier in the day. And that depends on people's schedules and their training and things like that. But you have that post-oxygen burn that happens after exercise. And I'm sure you guys are familiar with it, but basically your metabolism stays elevated, and it can take it several hours, sometimes depending on the intensity, up to 15 hours to get your body back down to your resting levels. Well, if you exercise later in the day or early in the evening, then your metabolism is still elevated. So you're on high alert in that fight or flight mode. So if you can exercise in the morning, then that helps you to relax a little bit more at night before you go to bed. And then eating carbs before bed. Studies have shown that eating some carbohydrates helps to kind of relax you a little bit and may help you fall asleep a little bit more. So in looking at some articles, sleep is a recovery tool for elite athletes. Athletes going to bed, if they can fall asleep within 30 minutes and sleep through the night with brief awakenings, they tend to feel refreshed within 60 minutes of waking on most days of the week. We know that sleep is important, so would we even think about screening athletes when it comes to sleep? And that kind of goes back to asking the right questions, that first bullet point up there. So why not just apply the principles of sleep and generalize from the research that's been done in other areas such as dealing with law enforcement, military, pilots. Lots of studies have been done on sleep deprivation in pilots, but we don't always take that research and apply it to our everyday people or our athletes. So as a result of the research and the knowledge, athletes and coaches and sports medicine physicians, trainers, they're all interested in understanding the relationship of sleep to training and recovery and performance. The complicating factor is that athletes, and elite athletes in particular, are very different from the average individual or members of occupational groups like law enforcement or military, where some of this research has been based. So, athletes have a unique physical ability. They have different mental demands. They have to accommodate rigorous competition schedules and training schedules and have to adapt to difficult travel regimens. So we have to be careful and specific about applying what we know about sleep to athletes. So there's a clear need for developing valid, reliable tools to help screen and monitor athletes' sleep behaviors in order to understand and develop, effective interventions for them. The University of Calgary Sports Medicine Sleep and Human Performance Research Initiative has developed the Athlete Sleep Screening Questionnaire, or ASSQ. Everybody's got an acronym, right? And it's designed to capture athletes' sleep behaviors, identify athletes with abnormal sleep and primary sleep disorders, and determine the frequency which an athlete is having difficulty with sleep, especially when traveling. The goal of all of this is to get a clear understanding of the relationship between sleep and recovery, of course, and understand this questionnaire, how it can be used with elite athletic teams. So the three parameters, the relationship of sleep to post-exercise recovery and regeneration, can be viewed in a structural fashion. The first one is sleep length, which is the total sleep requirement, hours per night plus naps. Number two is the sleep quality. And that includes things like sleep disorders, environmental disturbances, or fragmented sleep where they keep waking up periodically. And then the third phase is the third one is sleep phase, which is dealing with circadian timing of sleep. And it's interesting, when I went to massage school many, many moons ago, we always talked about circadian rhythms, and the Western world kind of poo-pooed some of that. And it's interesting that this is becoming more and more of a hot topic, these circadian rhythms. So for sleep length, for the sleep to be recuperative, it must be of adequate length. So it's a universal principle, but applies especially to athletes whose physical recovery may need to be greater than the average individual because of the type of training that they do. So sleep requirements change over the course of an individual's life, as we all know. In particular, the amount of sleep required. So for example, 8 to 12-year-olds need about 9.5 to 10 hours of sleep. 12 to 16-year-olds may need about 9 hours. 16 to 22-year-olds may need about 9 to 10 per night. And of course, naps can count towards the total sleep time, but they should be restricted to 30 minutes and should be scheduled between 2 and 4 p.m. for the average sleeper, because that's when your body kind of goes into that funk. Strategic napping may be particularly beneficial for young athletes due to school commitments and training, may not be able to get the recommended amount of sleep per night. So your second part is the sleep quality that we mentioned. So maintaining a regular sleep nap routine, establishing a comfortable sleeping environment, and monitoring for sleep disorders can also help maximize sleep quality. A key indicator of sleep disorders is excessive sleepiness, despite having enough sleep length. So this may be due to non-restorative sleep, which is poor quality due to interruptions from sleep disorders like insomnia, sleep apnea, or restless leg syndrome. Sleep disorders are also common and treatable, but often remain undiagnosed. So it's especially important to find out if your young athlete suffers from sleep disorders, because intervention at a young age can make a huge difference in their long-term athletic development and performance. Travel can also affect sleep quality, so jet lag management and sleep scheduling with traveling is also very, very important. And then the third thing that we mentioned was the sleep phase, the circadian system. And that helps, the circadian rhythm helps regulate the feeling of sleepiness and wakefulness throughout the day, and that can definitely affect athletic performance. So after awakening in the morning, the average individual feels alert until about 2 o'clock, when the afternoon siesta kind of feeling starts to kick in. And this tends to last for 30 to 60 minutes, and then alertness rises again with a peak in the evening around 6 to 8 p.m. That's that second wind that people say they tend to get, and that's just normal. So after this point, sleepiness after the 8 p.m. starts to increase, which facilitates the onset of sleep at bedtime. Each athlete has a preferred sleep schedule that suits his or her circadian rhythm. However, training, school, exposure to technology, which is the F-Lux that we're going to talk about here, that's on the PowerPoint slide. We'll talk about that in a little bit. Work commitments, all of that can have an impact on the athlete's ability to match their circadian rhythm, what they need versus what they're able to do. So if the circadian phase and sleep schedule are not matched, meaning that they're out of phase, the amount of sleep that can be achieved as well as the quality of that sleep is going to be affected. For example, adolescents who have a natural tendency to become night owls, delaying bedtime. The delay in sleep onset, which 12 a.m. to 1 a.m. is in a combination with having to get up for school at 7 or 8 o'clock in the morning, and the fact that adolescents need 9 to 10 hours of sleep per day starts to result in chronic sleep debt that affects daytime performance and alters their mood, increases their appetite, impairs post-exercise recovery, all of these things. So we want to make sure that athletes are getting the sleep that they need. And, you know, like we said, there are questionnaires that are out there, this ASSQ questionnaire that has been used And it's been used for about 6 years. It took about 6 years to put it together. And the goal for the people who created it was to gather enough information on athletes' sleep behaviors to enable nationwide screening of a large population of athletes and provide efficient data for research and validation. Um, the sleep difficulty score is calculated. It's derived from standard sleep screening questionnaires. It's made up of 23 items that represent 4 different domains. And the 4 domains include the first one meaning there's no clinical problem, so the person may need, their intervention needs to be education about how to get better sleep. The second is mild clinical problem, which would be a combination of education and a little bit of monitoring. A moderate clinical problem where they may need to see the sports physician for further treatment. And then a severe clinical problem where they may need to see a doctor that specializes in sleep abnormalities and diseases. So between its launch in 2011 and the end of 2013, 307 athletes completed it. 132 were male, 168 were female, and basically 13% of the athletes screened had sleep difficulty scores requiring them to have a follow-up with a consultation with a physician. So a lot of the athletes in the end reported satisfaction in their sleep and tended to have total sleep times averaging over 8 hours per night, whereas the athletes reporting dissatisfaction with their sleep tended to have sleep hours that were less than 7. So again, kind of reemphasizing the importance of getting the right questions from your clients about their sleep quality and how they're feeling, and knowing that once they get up in the morning they should start to feel a little bit more awake after an hour, and is this happening to this person, and if it's not, what may be going on. The F-Lux that is over here on the slide, it's a computer program that adjusts the displays, the color temperature according to the location and the time of day. And some of your computers and smaller devices may have this. And if you don't, it's good to get it because it was designed to reduce eye strain during nighttime use and help to reduce disruption of the sleep patterns, because we know that light triggers the brain to think that it's daytime and it needs to be awake. And that's the challenge with a lot of our electronic devices, computers and stuff, that the light is making our bodies think we need to stay awake when we're using them at night, and we need to start thinking about going to sleep, and then people can't fall asleep. It's available for Microsoft Windows and Linux. It's also available for your iOS devices. So you just install it. You get these programs. You can install it, and it just alters the color temperature of the display to reduce the prominence of the white-blue light at night to help improve effectiveness of sleep. And reducing exposure to blue light at nighttime has been linked to an increased melatonin secretion. So, the developer provides a list of relevant research on their website if you're interested in finding out some more information about this, but it's been widely used. It's had a lot of positive reviews by technology journalists and bloggers. So it might be something that you can encourage yourself or your clients or your athletes to check out. Some other things that we can do to recommend improvement of sleep is kind of a sleep hygiene tip list here. The first one is sleep only when you're sleepy. And this reduces the time that you're awake in bed. So if you can't fall asleep within 20 minutes, get up, do something else, something that's boring or something that will help you to become sleepy. You can sit quietly in the dark. Read the warranty on your refrigerator. That would put you to sleep. But just make sure you don't expose yourself to bright light while you're up, because like we said with the computers and stuff, the light cues your brain that it's time to wake up. Sometimes people find that if they do take naps, then it throws off the time that they should go to bed. Now, we just said a little while ago that naps could be a good thing, and that is true if you have a sleep deficit. But sometimes, taking naps might throw off your bedtime. So you just kind of have to see what works best for you as far as it comes to naps. But do get up and go to bed same time every day, even on the weekends. And I know we've mentioned that before, but that helps get your sleep cycle into a regular rhythm. Refrain from exercise at least 4 hours before bedtime because we know, like we mentioned, regular exercise is recommended to help you with sleep, but the timing of the workout is important. So exercising in the morning or early afternoon typically doesn't interfere with sleep. And then develop some sleep rituals. So give your body those cues that it's time to start slowing down and relaxing so that you can fall asleep. So maybe listening to relaxing music, read something soothing for 15 minutes, have a cup of caffeine-free tea, do some relaxation exercises, anything that will help you kind of develop your routine. And another one, I'm sure you've heard it before, is only use your bed for sleeping. Get rid of the TV that's in your bedroom. That's a challenge for some people. Some people just love to have that TV in their bedroom, and it's not a good thing because, again, it has to do with the lighting and the stimulation, especially depending on what type of TV program you're watching. So avoid watching TV in bed. Avoid paying bills or working or reading in bed. Use that as just your bedtime. Stay away from caffeine, nicotine, alcohol at least 4 to 6 hours before you go to bed. We know that caffeine and nicotine are stimulants. They interfere with your ability to fall asleep. So your coffees, your teas, your soft drinks, cocoa, chocolate, sometimes your prescription or non-prescription medications like things that help you with headaches. Sometimes they help you with headaches because they have a wee bit of caffeine in there. Cigarettes, some of your medications, some of these may contain nicotine or caffeine. And alcohol may seem to help you sleep in the beginning as it slows brain activity, but in the end, you'll end up having fragmented sleep. So alcohol is not a good thing to turn to if you're trying to fall asleep and have a good quality sleep. And sometimes having a light snack before bed may help you. If your stomach's too empty, it can interfere with sleep. However, on the flip side of that, if you have a heavy meal before bedtime, that can interfere with sleep as well. Dairy products and turkey contain some tryptophan, which can act as a natural sleep inducer, which is why typically a warm glass of milk at night might be recommended. So if you can handle dairy, then that might be something to try. Another recommendation may be taking a hot bath 90 minutes before bedtime, because a hot bath will raise your body temperature, but it's the drop in the body temperature afterwards that may leave you feeling sleepy. So, that may be something to try. Making sure your bed and your bedroom are as quiet and comfortable as possible. If your room is hot, that may make it hard for you to fall asleep. A cooler room with enough blankets to stay warm is usually what's recommended. If light early in the morning bothers you, get some blackout shades or wear one of those little sleep mask things. If noise bothers you, try a white noise machine or wear some earplugs. So make sure the environment is appropriate for your sleep as well. And maybe use sunlight to set your biological clock. That may be something that can help you as well, because as soon as you get up in the morning, go outside, turn your face to the sun for 15 minutes, and that may help to kind of wake you up. So those are just some other little tips that you can use to help you out some. We mentioned, still on the same slide, sorry, carbs before bed. There have been quite a few studies that show that high glycemic index carbohydrate meals shorten sleep onset. So that may be something that can kind of help you out as far as improving your sleep. So high glycemic foods, help with the conversion of serotonin with the brain. Your high glycemic carbohydrate meals kind of hasten the glucose entry into the blood and facilitates greater insulin response in healthy adults. And in response to increasing plasma glucose concentration, it can kind of help to lower and relax the mind a little bit. So carbs before bed, but again, not a big old heavy meal. So all of these are little tips that, you can try one, two, all of them, and see what works best for you. Now, as far as nutrition and recovery go, you got to refuel, rebuild, rehydrate, recover. This right here just kind of says it all. And we need to start with proper fundamental whole food nutrition. We need to look at post-workout nutrition strategies as well, such as making sure that you get carbohydrates within 30 minutes after your exercise program, or else your glucose levels start to get affected and you start to feel tired and sleepy and out of it. And then anti-inflammatory nutrition recommendations. So let's look at your post-workout nutrition, because a lot of people look at their day-to-day and hour-to-hour nutrition, but they don't often think about what they need to eat right after they exercise. So your post-workout nutrition goals are to reduce protein breakdown so that your muscles can recuperate faster, increase the protein synthesis, and replenish your glycogen stores. So your guidelines to help you with this is your timing is very important. It depends on your pre-workout meal. Your endurance-based exercise, you're looking at a 4-to-1 ratio between carbs and proteins. And for your resistance-based exercise, you're looking at a 2-to-1 ratio between carbs and proteins. So when the post-workout meal should be consumed is based on when or if a pre-workout meal was consumed. So the goal is to keep the pre and the post-workout meal within a 4 to 5 hour window of each other. Performing exercise continues to be a hot debated topic in the industry. So sometimes there may be reasons for it, while other times it may hinder performance as far as your nutrition goes and when to eat. There's some evidence that fasted exercise helps enhance mitochondrial density. But again, it just depends on how your body responds. Fasted workouts don't work for everyone, especially if they already have a tendency towards low blood sugar. So it's just important to listen to the body when it comes to nutrition, but also look at these ratios. Of course, when you're doing endurance type activities, you're using up a lot of your carbs. So that's why the ratio of carbs to protein is higher than it is for your strength training. So types of carbohydrates. Your primary goals for recovery is to increase, like we just mentioned, increased insulin and glycogen recovery. You've got your high versus low glycemic load. Maltodextrin is something that we'll talk about here, and then fructose and the liver glycogen. So the type of carbohydrate does matter immediately post-workout, especially if another workout session or competition is going to occur within 24 hours. So stick with the high glycemic load carbohydrate foods to enhance glycogen replenishment. And this is not an excuse to eat high sugary, high calorie foods. It needs to be good quality. So many are misinformed about fructose because of all the commercials on TV and think that eating fruit is going to make you fat. If exercise intensity with high and long enough liver glycogen stores may be depleted, and it must be replenished. So fructose is preferentially taken in by the liver to be metabolized and used to replace glycogen stores. If fructose levels get too high, over 50 grams per day, it could stimulate lipogenesis. If fructose is coming from whole fruit sources, this will not likely happen. So if fructose is coming from high fructose corn syrup and juices, then yeah, it may be an issue, but fruit, not so much. So fruit is not a bad thing. Now, your types of protein. The role of protein post-workout is mainly to increase muscle protein synthesis. So your complete proteins must be consumed for synthesis to occur. So these are going to be your animal-based, quinoa, which is what this little picture is over here, amaranth, tofu. These are all great sources. Food synergies, food combinations. You can combine your legumes with whole grains to have a really good compatible carb and protein combination. You can also combine legumes with nuts and seeds. That's another great combination. And then some other food synergies. looking at the 1 plus 1 equals 4. That's that crazy math. Some foods provide synergy with themselves or with other foods to help maximize the absorption and availability of nutrients within the foods. Potatoes eat with the skin, for example. They prevent the loss of some nutrients in the potato. The same goes for apples. Potatoes, especially with the skin, that's where you can get a lot of your potassium. So when you pair certain foods together, they increase the availability of nutrients as well. Tomatoes are rich in lycopene, but when you cook tomatoes with broccoli, the power of the lycopene is enhanced a lot. So combining those two together is great. A small study that was published in May in the American Journal of Clinical Nutrition concludes that adding eggs to salads makes it easier to absorb the carotenoids in the raw vegetables. Carotenoids, just FYI, they're the yellowish red pigments that give carrots and tomatoes and lots of other fruits and vegetables their color. And two famous ones are beta-carotene and lycopene. So in addition to giving us those pretty colors, they also provide beneficial phytonutrients that help fight inflammation. And if you remember way back at the beginning of this lecture, we talked about not only muscle and joint inflammation, but we also mentioned about blood vessel inflammation and heart disease. So this is a great combination to help reduce that. Vitamin C-rich lemons help to maximize your body's ability to absorb catechins, which are the disease-fighting antioxidants that are found a lot in green teas. Turmeric, combine it with black pepper, and that's going to help your body absorb 1,000 times more curcumin, which is the active ingredient in turmeric. Lots of great food combinations that can help you with your exercise and with your recovery. And we don't want to forget about fats. Fats are not always bad. It's when we get too much of them that it's a bad thing. And like we mentioned earlier, anything that's good for you, if you get too much of it, is not a good thing. So you want to make sure with your fats that you're getting your omega-3s because they do help control inflammation and help to enhance recovery. They help to encourage tissue remodeling, and they also have neuroprotective effects. Sources for your omega-3s, your fish and fish oils, your flax seeds and oils, chia seeds, wheat germ. These are all great things, and you can add these pretty much to anything to help get it in your diet. You don't have to eat it by itself. And your recommended amount is 3 grams per day. So don't forget about those fats. And you've got your Dr. Wheel's anti-inflammatory food pyramid. It's similar to the Mediterranean diet. It focuses on healthy fat sources and whole grains and fruits and vegetables. And it's designed as a practical guide that consumers of all ages can use to help counteract chronic inflammation. So for example, the bottom, and this is a little blurry, but the bottom, you're looking at the base of the pyramid, which is the foundation of the anti-inflammatory pyramid. You're looking at vegetables, both raw and cooked, from all parts of the color spectrum, 4 to 5 servings a day minimum. And if you're looking at 1 serving, it's equal to 2 cups of salad greens or half a cup of vegetables, cooked, raw, or juiced. Some healthy choices, looking at your dark green leafy vegetables like spinach, collard greens, kale, looking at things like broccoli, cabbage, Brussels sprouts, all kinds of different things. And the reason that this is a good foundation of the pyramid is that the vegetables are rich in the flavonoids and the carotenoids, which are both antioxidants, anti-inflammatory. They go for a wide range of colors. Eat them raw, eat them cooked, organic if possible. If you're into that, just a great foundation. And then with your fruits, fresh in season or frozen, organic when possible, 3 to 4 servings a day, because these are also rich in flavonoids and carotenoids, again, offering antioxidant and anti-inflammatory type benefits for it. So you're still looking for the wide range of colors, preferably fresh. So you're looking for the ones that are in season, or frozen's okay. Then your next level, which up here, is your whole and cracked grains. We're looking at 3 to 5 servings a day. And why do we want to have them? We're looking at brown rice, basmati rice, wild rice, buckwheat. The whole grains digest slowly. They reduce frequency of spikes in blood sugar that promote inflammation. And whole grain means grains that are intact or in few large pieces, not whole wheat bread or other products made from flour. Next to that whole grain, you're looking at pasta. Pasta cooked al dente, which is when it has a tooth to it, so to speak, has lower glycemic index than fully cooked pasta. Your low glycemic, low carbohydrate should be the bulk of your carbohydrate intake and help minimize spike in your blood sugars. And then next to that, you're looking at your beans and legumes. Beans that are rich in folic acid, magnesium, potassium, soluble fiber. They're also low glycemic, so you can eat them well cooked, either whole or pureed into spreads like hummus or something like that. Your healthy fats, looking at your extra virgin oils, canola oils, nuts, especially your walnuts, avocado seeds. You're looking at 5 to 7 a day, 5 to 7 servings a day. Your fish and seafoods, 2 to 6 servings a week. Looking at salmon, these are rich in omega-3 fats, which we just talked about, high anti-inflammatory benefits. Your whole soy foods is the next level up right here. So you're looking at 1 to 2 servings a day, and soy foods have isoflavonoids that have antioxidant activity and protective against cancer. So choose whole soy foods over the fractionated type foods like isolated soy protein powders and fake meats, that kind of thing. Get the real stuff. Your cooked Asian mushrooms. These mushrooms contain compounds that enhance immune function. Never eat mushrooms raw, and minimize consumption of common commercial button mushrooms, including the crimini and the portobello. But it's some healthy choices might be the oyster mushrooms, wild mushrooms if available, the Shiite type mushrooms. Next up, you're looking at healthy herbs and spices, such as your garlic, your ginger, turmeric, cinnamon. They are powerful anti-inflammatory agents. Your white, green, or oolong tea, it's rich in catechins and antioxidant compounds that reduce inflammation. So you just want to make sure you buy high-quality tea and learn how to correctly brew it in order to get its maximum taste and health benefits. Supplements are kind of up at the top. They can help fill in any gaps in your diet when you're unable to get your daily requirements, but you want to make sure that you get it through your food and have to depend on supplements very minimally. And then your red wine, no more than 1 to 2 glasses a day, has a beneficial antioxidant activity, but like we said, we want to limit the intake to no more than 1 to 2 servings a day. And if you don't drink alcohol, don't start drinking the wine, because there are other ways that you can get that through the foods that we just talked about. And then at the very top of the pyramid are healthy sweets, such as plain dark chocolate. Dark chocolate provides polyphenols with antioxidant activity. You want the dark chocolate with at least 70% pure cocoa and have an ounce a few times a week. Fruit sorbet is a better option than other frozen desserts. So, again, this just kind of gives you some ideas. And of course, you can kind of look this up on Dr. Wheel's website if you want some more information on this. So looking at types of fatigue, there's 4 main types of fatigue that a client can experience. You got your metabolic, and that's tied into fuel sources or not enough fuel sources. You've got neural, which involves your peripheral and your central nervous system. You're just brain fatigued. You've got psychological, which can be emotional or social stress. And you've got environmental, which can be climate and travel related. So when a particular type of fatigue is observed, the key is to find the appropriate type of recovery to implement. So the 3 main methods of recovery include what we've kind of talked about: nutrition, physical therapies, and one we haven't talked about yet is the psychological techniques. So looking at signs of fatigue, this chart stresses that the trainer or the physical therapist or whatever your area is communication, observing and listening to their clients to make sure that they know if their client is experiencing fatigue and risk overtraining. Your recovery strategies, there's all kinds of different strategies that you can have. The risk of insufficient recovery and potential burnout is high if we don't deal with these accordingly. So we know that burnout afflicts overly dedicated, idealistic men and women who are highly motivated towards high achievement. And they work in sometimes unrewarding situations. So basically, we're talking about those who work too hard, too long, too intensely, and are extremely dedicated to what they are doing. These are the people that we've got to kind of be keeping an eye on. So your direct communication, the client says they have heavy legs, they don't feel good, they're tired, their legs are sore. Body language, actually 90% of our communication is through body language. So facial expressions, posture, signs of frustration. Maybe they're not communicating this to you, but they're exhibiting it. Their performance is affected, poor skill execution, heavy legs, slow acceleration, slow decision making or response time. The low concentration, low motivation or aggression, low self-confidence. We're looking at psychological issues. Also increased instances of anxiety. Confusion is another one for psychological. And then your gut feeling, that sixth sense lifestyle, their poor eating habits, poor diet, poor sleep patterns, external stress. So it's important for coaches and fitness trainers and therapists to be aware of and monitor these non-adaptive responses. And it's also vital that the athletes themselves have the ability to monitor their own emotional states. In recent years, sports psychology research has seen the rise of a concept named emotional intelligence and how can it help in sports performance. And emotional intelligence is defined as the capacity to recognize and utilize emotional states to change intentions and behavior. And it can be summarized as the ability to recognize different emotional states, being able to assess the effects of emotions on subsequent behavior, and the ability to switch into the best emotional state and manage a particular situation. So the first stage is developing emotional self-awareness. So the capability to change emotional states and learning how to change emotions in relation to performance requires self-awareness. So we need to be able to identify or have our clients identify when their emotions are influencing their performance and how our emotions can change over time. So we need to be able to assess the emotional states that other people are feeling, pick it up on their body language, verbal and nonverbal gestures. So there are many ways to assess emotions, including the standard psychometric test. However, athletes often find repeated completions of standardized scales to be tiresome, understandably. An alternative approach is to use an open-ended diary approach type, such as a video or audio diary. So assessment of emotion should start by asking the athlete to think carefully about a situation in which a performance was important. And it helps if the athlete spends some time rehearsing the situation in their mind, tries to remember how they felt, then the athlete can write down all of the emotions that they experienced. They should also rate how they performed in the situation to allow comparisons between successful and unsuccessful performances. So emotions such as anxiety, they can be positive and negative. So if somebody's anxious, just enough to stimulate them to stay focused and do well and have the energy to do well in their performance, that's great. If they're so anxious that they start making mistakes and goofing up, and then that's not going to be a good thing. So it's a combination of emotions, the thoughts that are linked with the combination that helps determine whether the emotions are motivational or demotivational. So a key point is that it's important that the athlete should assess both their own emotions and those of their teammates, maybe using mental imagery to help recreate the situation, and note which were associated with best performances and which were associated with poor performances. Um, so these are things that can help these athletes, but also making us aware that we need to be tuning in to our clients as well. The next stage after recognizing that is to develop self-awareness of emotional states during their daily performance. So stage 2 kind of builds upon what we just talked about, which was stage 1. So stage 1 provides extreme emotions and links them to successes and failures. Then stage 2 needs to provide the running commentary, so to speak, of the emotions. So some examples, your client or your athlete felt furious during the drive into training. So too many people on the road, why do bad drivers follow me to work? And then the next thing you find is they felt tired this morning, they struggled with training this morning, they became frustrated, felt a little angry. Did they feel happy with their overall effect that they made in training, or did they become irritated later in the day over trivial matters and can't think why, but was just angry anyway? So you can kind of notice how emotions from things other than sport or training can influence how we interpret new situations. I mean, how many times have we done that? Stuff on the road gets you frustrated, and all of a sudden you have a bad day at work because of that. So, for example, this player who was frustrated and felt angry during the drive into training, as a consequence, became angry during training. And likely that his poor tolerance of errors by others or himself was in part because of feeling angry and tired before training even started. So, becoming aware of that. The third stage is identifying strategies to regulate the emotion. So it's important to remember that there are ways of dealing with emotions, such as anger and anxiety, without the need for intervention by a sports psychologist. So for example, research has found that listening to music is an effective way to change emotions. So that soccer player that we were talking about recognizes that he preferred to release feelings of anger publicly, with the result that everyone around him knew that he was annoyed. However, the anger might have been helpful to him. It might not have been helpful to the other team members, who might not have understood why he was angry, especially as they were not able or were not aware that he was, started getting angry on the drive into practice. So equally, he uses the team for emotional support. It's seemingly unaware of his influence and his expressions of anger by his teammates. So you may have that teammate who's angry and you don't even know why. And you're like, God, they're mad at me because I made a mistake. But it could be something that had absolutely nothing to do with that. It started way before practice. So set emotionally focused goals. That's stage 4. So once an athlete becomes aware of emotions that he or she is experiencing, the effect these have on teammates, and importantly, whether the emotions were helpful or unhelpful, the next step is to try to change these emotions. For example, identifying the athlete may experience dysfunctional anger when tired can lead to effective strategies designed to control these feelings. So goal setting has been found to be an effective intervention strategy with all kinds of different skills, but the desire for change is crucial. So resistance to the notion of the adverse effects of negative emotions on others will only serve to maintain the lack of cohesion in a team setting. So use these to help set goals and help engage in positive self-talk, which is the 5th one. So once the individual has identified a need for change, developing an appropriate self-talk diary that can run alongside a diary used to record emotions can be helpful. I mean, when you interview athletes, when you see athletes getting interviewed, they don't talk negatively about themselves. They try to talk themselves up. And it's funny because people come across as saying, oh, that athlete's so arrogant. Well, they're not being arrogant. They're just trying to stay positive. The 6th thing that you can do is to role play to develop emotional control and competencies, because that can help everyone understand each other's emotions and how they deal with it, because different people deal with different things. So There are lots of other methods. There's debriefing. A good debriefing approach helps both the coach and the athlete evaluate a performance, whether it's a good performance or a not so good a performance. Emotional recovery or a contingent plan. And actually, we kind of talk about this in a little bit, but your contingent plan is also in case there's a major setback or a traumatic situation or event that may affect the athlete into coming to terms with the situation. So it's important that coaches and athletes have their own individual strategies established in advance in case such a situation occurs. Contingency planning is important. It's very important to prepare for handling emotionally traumatic events that can distract your athlete's attention away from potential sources of stress. So some of the simplest distractors used during tournaments or competitions are mood lifting activities. So this can include watching funny movies or comedy shows or reading an adventure book or going to a fun park or a zoo the day before your event, something that creates a sense of humor or feeling of camaraderie with the team or team support. All of these are things that can help. So let's look at this next slide here. So looking at warning signs of under-recovery. When observing fatigue, psychological signs will show first. Then they will show signs of physiological fatigue, and then finally performance will be affected. So this stresses the importance of not relying on performance reduction to figure out that your person's not recovering, because at this point, fatigue has already set in, and it's going to take a longer time for your person to recover. So your signs of under-recovery, you want to, like we said, educate your clients before all of this happens. And some things would include sudden drop in body weight. Sorry about that, had to take a sip of water. A sudden increase in morning heart rate. We talked about this increase in the resting heart rate as a cardinal sign of lack of recovery. Inability to respond to relaxation or meditation. So, maybe they responded well to their yoga or mental imagery in the past, but now it's taken them, several sessions to feel the effects, or they're not feeling them at all. Sleep disturbances, which we have talked quite a bit about already. Low quality sleep for 2 days or longer. And then constantly feeling tired or sore that is not disease related. These are all some pretty serious warning signs that something's been going on for a while. So what can you do to kind of, prevent some of these from, or prevent some of your athletes from getting to this point? Well, there's all kinds of apps for that, so to speak. So trainers and coaches should be using some of these tools. They can use these questionnaires, but like we mentioned, sometimes, people get tired of questionnaires. So there's a lot of technology that's out there. The Omega Wave, the HRV, bioforce.com is a website that you might want to check out some of the tools that trainers can use with clients to monitor their HRV training. And HRV training, HRV4training.com actually is a website that you might even want to check out. And it's an app for your phone, and it helps to adjust your trainings based on objective measures of recovery. It's got an advanced analysis of acute heart rate variability changes to analyze the impact of training load on your physiology and your recovery. So it's looking at heart rate variability, because we know that when we're stressed, the heart rate goes up. When we're relaxed, the heart rate comes down. So it looks at this and analyzes it. And it's training load analysis, so it looks at acute, chronic, fitness and fatigue, readiness to perform, and injury risk. I mean, it looks at all kinds of very cool things. And the more you measure with this, the more you get. So if you're interested in some of these devices or some of these apps, check them out. HRV4training.com is one of them. And the bioforce.com is another one. So cool little things that you can use to check this out. You can also look at heart rate variability, which I just mentioned, the HRV. It's a measurement of the time interval between heartbeats. And if you're looking at an EKG, it's the R to R interval. So, you've got, if you're familiar with EKGs, which I just happen to be a little familiar with these, you're looking at ventricles right here. So your P wave, which in this EKG is right here, is when the atria contract, and then your QRS wave, which is right here, is looking at when the ventricles contract. And, of course, from your physiology, the ventricles are when the heart's especially that left ventricle is pumping that blood and oxygen and nutrients out to the rest of the body. So if you want to measure heart rate by looking at EKGs, you measure it by going from R wave right here to R wave. And there's a variety of different methods that you can use to calculate heart rate. But this is what the heart rate variability is using. So it can measure the balance between the parasympathetic nervous system and the sympathetic nervous system in controlling the heart rate, because the R wave is kind of what we use to calculate heart rate sometimes with EKGs. So it provides insight to stress levels of recovery, and just is a way that some of these apps use to monitor your stress levels, because the higher the heart rate, maybe the higher the stress, depending on whether it's good stress, such as exercise, or not so good stress. Now, the Rusco heart rate test. It's a very simple heart rate monitoring test that's currently being used with many athletes all over the place. And it's a detailed method that appears that I'm going to go over with you, but it's essentially all you have to do is lie down quietly in a comfortable position for a few minutes, then stand up and remain still for a couple of more minutes. The test initiates a heart rate response to the standing motion based on gravity that the body has to quickly adapt to. So since this test is done under a fairly sensitive control and feedback system, it responds to positive and negative training, competition loads, as well as the onset of illness and other little stresses in a fairly, sensitive in a good way. So it requires the athlete to have a recording or memory type heart rate monitor or a standard display heart rate monitor. And if the athlete does have a recording heart rate monitor, it should be set to record every 5 seconds of the last 4-minute period of the test. So let me repeat that. If the athlete has a recording heart rate monitor, it should be set to record every 5 seconds of the last 4-minute period of the test. So the client, if the athlete or client does not have a recording heart rate monitor, then the athlete should just record and calculate 3 data points visually. And I'm going to go over these 3 data points. So you're going to start by lying down and waiting until you're relaxed and your heart rate is stabilized. Then you're going to start your watch. At 2 minutes, stand and stay standing for another 2 minutes. The important heart rate values are the average of the 2 minutes lying down, 15 seconds after standing, and the average of the last 30 seconds of standing. Okay, so start by lying down, relax until your heart rate is stabilized, which is about 2 minutes. Stand and record your heart rate 15 seconds after standing, and then average the heart rate between the 90th and the 120th second, which is the average of the last 30 seconds of standing. And this will give you an idea of what your heart rate's doing. So if your heart rate, the average between the 90 and the 120th seconds after standing is 8 to 10 beats above normal, then it's a possible sign of some failure to recover adequately. This may be due to hard training or poor recovery time or some of the other things we talked about, maybe an illness or other life stresses. On the other hand, if the heart rate is dropping slightly, then this may be due to some positive adaptation to training and competition. So you can also interpret the shape of the heart rate spike if you graph this between the athlete's profile of each athlete that you're looking for. But basically, if the heart rate is increasing, that may be a sign that you're not recovering well. If the heart rate is dropping slightly, then that's a good thing. That's what you want it to do. So some strategies for improving recovery. There are three main strategies, and we've talked about some of them, but there's nutrition, there's therapy techniques, and there's psychological skills. Nutrition and sleep are the foundation for recovery, which must be the first thing addressed, as we mentioned earlier. In the following slides, we're going to discuss different strategies that might be helpful in terms of physical therapy and psychological skills. So, hydrotherapy, warm water. A wide range of hydrotherapies have been used in restorative therapy for several thousand years. Spas, pools, steam rooms, cold pools, contrast temperature protocols, these were all used by the ancient Greeks and Romans. So they got something right there. One of the few published articles on the effectiveness of hydrotherapies comes from research with nationally ranked Finnish track and field athletes. This was from, if you want to get some more information on the study, it was Vitasalo, Vitasalo, back in 1995. What these researchers demonstrated was that underwater massaging using the jets in a spa following plyometrics training helped athletes to maintain leg explosiveness on the following day. In contrast, passive rest, such as training, resulted in a significant reduction in leg power. The protocols that were used by the Finnish researchers were very similar to those used by the ancient Romans. Essentially, this routine involves first having a shower, followed by a spa, which is about 39 to 40 degrees Celsius, for 3 minutes, then a cold shower or a plunge into a cold pool, like 10 to 15 degrees Celsius, for 30 to 60 seconds. So they got in the warm water, 39, 40 degrees Celsius for 3 minutes, and then cold shower or cold pool for 30 to 60 seconds. Warm immersion produces vasodilation, and it produces that to the peripheral circulation. And then the cold immersion encourages vasoconstriction. 3 to 5 sets of this protocol produced rapid vasodilation, and vasoconstriction helps to accelerate blood flow. So a contrast temperature following the same protocol as outlined above was reviewed by researchers from the University of Canberra in 1996 to measure lactate recovery in high-performance hockey players after a series of Wingate tests, which is a power bite test. And the results indicated that lactate levels were recovered equally fast by using either the contrast water immersion protocol or active recovery protocol. So lactate recovery following passive rest was significantly slower. Showering within 5 to 10 minutes at the end of a training session is a good way to accelerate recovery of both lactate and peripheral neural fatigue. Contrasting the temperatures can be achieved with a shower or bath at home, or using a small paddling pool or a tub for cold immersion if you want to. So it does help, and it's a great way to help improve recovery. So like we mentioned, you could do the warm shower for 5 to 10 minutes post-workout. Helps to increase lactate clearance, improve neural fatigue. Water jet massage, if you're lucky enough to have one of those available to you, help to maintain leg explosiveness the following day. What you're looking for is 12 to 15 minutes, 4 to 5 days per week. Do not perform this, though, if there's a second workout plan for that day, because it may throw off your results and backfire on you. Your cold water immersion, you're looking at 50 to 59 degrees Fahrenheit. We had Celsius earlier, but basically the same. Like we mentioned, it helps increase vasoconstriction, which in turn helps to improve nerve transmission. It limits metabolic byproduct and inflammation, and that's something that you can do 10 to 15 minutes after intense training. So these are all little methods that you can do. And then your contrast therapies. These protocols we mentioned were just used by the Finnish researchers. I kind of jumped the gun on that. But again, with your Finnish researchers, they alternated warm for 3 minutes, warm water for 3 minutes, and then a cold shower for 30 to 60 seconds. And they alternated that several times, 4 to 5 times, and had very good benefits as far as getting rid of lactic acid and post-recovery benefits. Your flush active recovery. These are post-workout active recovery, helps to stimulate flushing out metabolic waste products that occur, bringing new blood to the muscles to help enhance repair and recovery, reduces delayed onset muscle soreness, and may also enhance performance. So swimming, jogging, calisthenics, cross-training, a lot of these will help as opposed to sit around and doing nothing after your training. So the effects of recovery swim on subsequent running performance. This is a research that was done. And basically the effects of a swimming-based recovery session implemented 10 hours post-high-intensity interval running on subsequent run performance the next day was investigated by researchers. 9 well-trained triathletes performed 2 high-intensity interval running sessions, followed by 10 hours later with either a swim recovery session or a passive recovery session. Subsequently, a time to fatigue run was completed 24 hours post-high-intensity training, and venous blood samples were taken pre-high-intensity training and post time to fatigue run to determine the levels of circulating C-reactive protein. And this C-reactive protein is very crucial as far as recovery and rebuilding of muscle, so to speak. So subjects were also asked to rate their perceived recovery prior to commencing the time to fatigue run. So the swimming recovery resulted in significantly longer time to fatigue as compared to the passive recovery. So basically what we're saying shows that swimming-based recovery sessions enhance following day exercise performance, possibly due to the hydrostatic properties of the water and its associated influence on reducing inflammation. So that's just one of the methods that you can do. But basically what we're saying is do some kind of active recovery to help flush everything out to help improve your chances of recovery for the next day. Compression garments. This is something that is gaining more and more popularity. More and more people are wearing these compression garments. And there are some potential benefits when worn during and post-workout because they can help to improve blood flow and help clear out the lactic acid that can lead to delayed onset muscle soreness and provide a decrease in perceived soreness. Now, notice it's perceived soreness because some of these studies, the jury is still kind of out on these, but sometimes, if your athlete or your client feels that it is helping them, whether it is or not, then sometimes there's mind over matter with that. So, if they feel like it's helping them and it's not hurting them, then what's the harm if it's not causing any problems? But there have been some studies done on the compression garments, and one study was done, this is in the British Journal of Sports Medicine, and the purpose of the study was to determine the effects of compression garments on recovery following damaging exercise. A systemic review and meta-analysis was conducted using the studies that evaluated the efficiency of compression garments on measurements of delayed onset muscle soreness, on muscular strength, muscular power, and creatine kinase. So the studies were extracted, and basically in reviewing a lot of these studies, the results indicated that compression garments can be very effective in enhancing recovery from muscle damage. Another abstract, let's see, in conclusion with this other abstract, the effects of compression garments on voluntary performance and recovery were minimal. However, reduced levels of perceived muscle soreness were reported following recovery in the garment. So even though the scientific physiological evidence wasn't there in the second study, the athletes still felt like they benefited from it. And like I said, sometimes mind over matter works more so and helps with recovery. So you just kind of have to take some of that with a grain of salt. Um, Now it's interesting the massage part coming up here because as a massage therapist, there's pros and cons to massage therapy, and the research in massage in the past couple of years has really increased because I think more and more people are realizing that it does have some benefits. And more research is showing that sometimes what we think it does not really do. But my point is that we didn't have hardly any research on massage 10 years ago. And I think because we are dealing more and more with European countries that massage is a part of their training program, that the American athletes are starting to investigate a little bit more. And you guys have probably seen it through foam rolling and trigger point massage, self-massage, that type of thing, not necessarily having to go to a massage therapist. So what studies have found is 10 to 15 minutes of massage post-workout may improve recovery and regeneration, because one of the things that massage does is it increases blood flow to various parts of the body and helps to get rid of some of the waste products. But, again, some of the research is limited on that. So some of the other benefits is that it can enhance proprioception, it can increase mitochondrial production, and help reduce the inflammatory markers that can lead to muscle soreness. Not everyone can get to a massage therapist, so sometimes foam rolling may be more practical for some of your athletes or some of your clients. We have a whole other program that you can take concerning foam rolling if you want to learn more about that. I'm not trying to do a marketing plug, but you do need to know what you're doing when it comes to foam rolling and trigger points. You can't just go out there and start mashing down on what I call lumpy mashed potatoes. But there have been several studies, as I mentioned, where scientists are identifying the mechanisms behind the massage therapy's benefits, and comparing biopsies to show that the interaction with muscle protein reduces inflammation and helps cells recover just from massage therapy. So the kind of work should be useful in getting these therapies reimbursed through insurance companies so that more and more people can benefit from it. But it is showing some promise. Exercise is the best way to reverse damage caused by common conditions such as diabetes and obesity and aging and injuries, but massage therapy can also help with that as well. And we're seeing more and more massage tables set up at marathon finish lines and road races and things like that. And we see it here at the university level because we do get so many athletes from outside of the United States that it's just always been a part of their training, and they find it odd that we don't have it as a part of American training. So another study that was done, this was in the Journal of Strength and Conditioning Research, August of 2015, and it was about the effects of massage on muscular strength and proprioception after exercise-induced muscle damage. And basically what they found was that massage, focusing more on the gastrocnemius muscle, after your massage therapy can definitely improve muscle strength and proprioception by influencing superficial layers of the gastrocnemius muscle. Foam rolling, which is our last little bullet point down here, is another one that has been used more and more as a recovery tool, especially after intense bouts of physical activity. Your foam rolling, helps to correct muscular imbalances due to excessive tightness in certain muscles, alleviate muscle soreness, relieves joint stress, improves neuromuscular efficiency, improves range of motion. It's been implemented in different rehabilitation and training programs to help promote soft tissue, flexibility, and extensibility, and to help improve joint range of motion. So, although foam rolling has been strongly advocated, it's commonly used, there have only been 3 peer-reviewed research articles published to date on this. Maybe a little bit more since this article was written, but this was June of 2013, so there has been quite a few since then. But foam rolling is an effective method in reducing delayed onset muscle soreness and association with performance decrements in sprint time, power, and dynamic strength and endurance. McDonald and his research team investigated the effects of acute foam rolling before physical activity and demonstrated that foam rolling had no effects on neuromuscular performance, although it significantly increased range of motion. So it just depends on what the benefit is that you're trying to get out of your foam rolling, but it does serve some good benefits. Um, in the research that McDonald did, they did find that the foam rolling group, the group that did the foam rolling as opposed to the control group, did show substantially less pain at all points of their research for comparison with the control group. Especially in the connective tissue, which was really more so at the myotendinous junction, which is a major site for muscle damage, disruption, and pain. So foam rolling was found in this particular study through McDonald to be considered very beneficial in the recovery of connective tissue. Also, that massage decreased pain and inflammation from the foam rolling, potentially by promoting blood flow to the areas of low blood flow, such as the muscle tendon interface. The foam rolling group recorded substantially less muscle soreness while having substantially greater decrements in evoked contractile properties, ruling out improved muscle recovery as a determining factor. So basically what we're saying is the foam rolling, when done correctly, can be very, very beneficial in recovery. The main thing is get trained on how to do it right. Now, breathing has been used for years to help us relax. Those that are stressed chronically underbreathe. And I call these individuals shoulder breathers because what we tend to do when we're stressed is we start to try to get more air into our lungs by lifting our shoulders and rib cage. And really all that does is tighten up accessory muscles such as your scalenes and your sternocleidomastoid muscle, which later leads to neck pain and neck aches, which starts to tie in with the occipitalis and the frontalis muscle that comes over the back of the skull to the eyebrows, and then you get that tension headache. And it doesn't let your lungs fill completely with air. Whereas diaphragmatic breathing, which is where your abdomen's moving the most, tightens the diaphragm or contracts the diaphragm, which causes the diaphragm to go from its dome-shaped, relaxed position to its contracted, flat position, which helps to elongate the lungs, which helps you to get a nice full breath of air. So one of the things that I have people do is if you place a hand on your chest, let's say your right hand is on your chest and your left hand is on your abdomen, and you just breathe like you normally breathe. Both hands are going to move, but one hand is going to move a little bit more so than the other. If it's your right hand that is on your chest, then you may be shoulder breathing, which may mean that you're a little stressed and you may not even be aware of that. If it's your abdominal hand that's moving, then that means that you're using your diaphragm to help you breathe, which is what we want, and that may mean that you are less stressed. So if we can get people to kind of get that biofeedback of, what are my hands doing if I just place them on my chest? Let me see what I'm doing for my breathing and concentrate on expanding the abdomen to breathe, so to speak, so you can engage or activate the diaphragm muscle, then that may help lower or slow their breathing down, which will help them to relax a little bit. Because we know that relaxed breathing helps to enhance the PNS activity, that parasympathetic, the parachute activity. It may help improve sleep and enhance recovery, especially this 4-7-8 breathing technique that we're going to talk about on the next slide. So some things that you can do, and actually let's flip over to this 4-7-8 method, is you place your tongue at the roof of your mouth, breathe in through your nose for a 4-second count, hold it for a 7-second count, and then exhale through your mouth, but take 8 seconds to exhale. And then keep repeating that over and over again. And maybe don't do it right now because you might start to fall asleep, but what it has helped a lot of people do is if they are in bed and their mind is racing and they can't fall asleep, they start to do this 4-7-8 method. and it helps increase parasympathetic activity, which in turn helps them to become a little sleepy, and next thing you know, they're dozing off. So this is a method that you can recommend to your people who may be having trouble falling asleep and see if it helps them. Your cobblestone mats. Now, I thought this was interesting when I saw this, but it roots back to traditional Chinese medicine. It gets into reflexology. And as a massage therapist, but as a Western medicine-oriented massage therapist, I always kind of poo-pooed the reflexology. You know, when you hear people say, oh, if I touch this area of your foot, I'm going to, get rid of your cancer. And I'm like, I don't know. But we all know that when your feet hurt, everything else hurts. And so reflexology is, I kind of take it from that standpoint that, if you just make the feet feel good, I love when the massage therapist is giving me a massage and they're getting ready to work on my feet. I'm just like, oh, that's my favorite part. And that's kind of what this is getting into. It's kind of a self-massage type, technique, so to speak, by using um, mats that kind of massage your feet when you walk on them. So the potential benefits of this is it provides better sleep. It improves proprioception because you have to kind of engage the Golgi tendons and the muscle spindles in order to stay balanced on these little mats. And it increases a sense of well-being because your feet are feeling yummy, and it reduces blood pressure. So there have been studies that have been done where if you use this for 30 minutes, 3 days per week, it will really help relax you. And you can make your own little rock mat for the shower, uneven rocks to stand on. I've got an article here from the New York Times talking about exercises that help older people stay on their feet, and they're both Chinese exercise techniques. The ancient martial art of Tai Chi, which we all know the benefits of that, and exercising by walking on cobblestones, because it may improve balance of older people or anyone who has balance problems and help prevent falls, which in turn can help people relax a little bit, reduce muscle tightness because they get tight and constricted because they're worried about falling, and it may help them relax a little bit. So in the Tai Chi study, let's go ahead and throw that one out here. They had 59 men and women with the average age of 78. They were divided into two groups. One group participated in a 12-week Tai Chi course. The other was continuing their usual activities without exercise classes. The Tai Chi group members did 10 minutes of warm-up, followed by 20 minutes of walking while moving the hands and the arms. After that, they did moderate range of motion exercises for the neck, shoulders, trunk, hip, knees, and ankles. And this class was held 3 times per week. And they basically, the Tai Chi, we know it's great. It helps keep joints and muscles moving, and it's just a great thing for older adults. Also, Tai Chi's breathing elements called Qi Gong are also important. So during Tai Chi classes and during this particular study, the emphasis on the breathing exercises during the movements was really encouraged to help maintain aerobic metabolism in their body during exercise. Then measures of muscle strength afterwards showed that the physical fitness of the exercise group improved significantly. Balance, which was calculated by how long a person could stand on one foot with their eyes open, also improved in the Tai Chi group. 31% of the people in the Tai Chi exercise group experienced falls during the period compared to 50% in the non-exercisers. So it reduced their falls. Now, there was the other group. Let's see. Each group participated in an exercise session consisting of 30 minutes of walking 3 times per week for 16 weeks. In this other study, one group walked on flat surfaces, while the other walked on the mats that replicated an uneven pattern of cobblestones, kind of like in the picture on the slide. And these cobblestones are common in walkways in Chinese parks, so it's kind of mimicking those cobblestones. The intensity of the exercise was carefully tracked to make sure members of the two groups were using the same amount of energy. Participants in the group improved on several measures of physical fitness that walked on the cobblestones. But the mat walkers had better balance, and this was tested by several different standing and reaching tasks, lower blood pressure, and faster times in walking 50 feet at the end of the study. So they also did better in a test of how fast they could rise from a chair, walk 10 feet, and then sit down. Um, the research scientist at the Oregon Research Institute, and who was also a co-author of the article, said that people had to get used to walking on the mats and that a few participants experienced some discomfort at the beginning of the training, but few people dropped out. And there were no exercise-related injuries, suggesting that the program is also suitable and safe for older adults, which means we could do it too if we're not older adults. So even though walking on the cobblestone mats proved to be more beneficial exercise, he did not recommend that older people give up their regular walking in favor of cobblestones. They're just saying blend this in a couple of times a week. 30 minutes, 3 times a day. They'll get some benefits from it. Now, your psychological skills, working on some ways that we can develop a little mental toughness, so to speak. Some ways that we can do this with our athletes or our clients is debriefing. So effectively evaluating performance can be a useful way to provide emotional and psychological recovery post-training or post-competition. A successful debriefing approach helps both the coach or the trainer and the athlete or client to evaluate performance objectively, identify what specific changes are needed, and then set realistic goals for the next performance or training session. An effective debriefing protocol should emphasize to the athlete or the client and focus on controllable processes rather than uncontrollable outcomes of performance, especially with your athletes. So effectively debriefing performances allows the athlete or the client to achieve some closure in regards to past performance, especially if past performance wasn't all that great. Your contingency planning is another method that you can use for psychological skills. In the case of a major setback or traumatic situation or event, additional resources may assist your athlete or your client in kind of quote unquote coming to terms with the situation. It's important that the coach or the trainer and the athlete or client have their own individual strategies established in advance in case a situation happens. Contingency planning is also an important aspect of preparation for handling emotionally traumatic events because they can be distracting to your athlete or to your client, and that can lead to more stress. So some of the simplest distractors, we kind of mentioned these a little bit earlier, could be watching something funny or, a lot of times teams will go out on little trips the day before a big competition to kind of take their mind off the competition. It's great for athletes if they have extended competitions away from home, especially if they're overseas. Just a nice little way to kind of get them to kind of chill a little bit. And then mental toughness skills, positive self-talk, recognition of complex interaction between the physical and emotional states is very, very important. It's evident with muscle relaxation is observed in conjunction with lowered heart rates and blood pressures and improved mood states. So skills associated with developing positive body language are some of the effective skills that have been used by elite athletes for years. So just positive talk. Telling yourself you could do this. I mean, you never hear athletes going, I can't do this, I can't do this, I can't do this, because they know that it's mind over matter sometimes, a lot of times. So if they keep telling themselves, I can do this, I can do this, then their body starts to respond to that. And that's kind of what we're talking about here. And then your relaxation techniques, and we see this a lot of times with athletes and even with our exercisers. Music is a big one. When you have people listening to whatever music invigorates them, or if they're in an athlete or a sport that they need to relax, like some of your, the winter biathlon where they have to shoot and they need to be relaxed. So if they have a song that can get in their head that helps them to relax and chill so that they can aim correctly at the target, so it's not just about invigorating, it's also about relaxation. So some other things that they can use, mind muscle techniques, visualization. I remember using this a lot when I was an athlete, and we see this all the time where athletes may just be lying down somewhere with their headphones on, chilling, and what they really may be doing is visualizing themselves performing the skill that they're getting ready to do and see themselves performing it correctly. It's interesting that studies have shown that even just lying there, not moving anything, when you are visualizing yourself moving muscle parts or body parts, that your brain actually sends some signals down the spinal cord to those muscles. And studies have actually been done on people who have a cast or something else that's limiting their movement, and they have found that people who visualize, especially if they have a cast on their leg and they visualize moving the leg, that the recovery after the cast is taken off to get the muscle back up to par is they don't have to work as long to get it back to where it was before because they were still getting some neurological impulses down that affected leg even though it was in a cast. So it's really amazing stuff that the mind can do to the body. So using what works. I mean, we've talked about lots of different ways to relax and how sleep is one of your most important things. And you just got to find what works for you. And that's where we have to get in tune with the body. Some other things that may help you, and I mean, this picture, just looking at it, looks relaxing. Your flotation spas. You may have some of those in your area. Acupuncture, as crazy as it sounds, having a needle stuck into you, sometimes that can help as far as recovery goes. Meditation, whatever that meditation is for you, whether it's just sitting quietly, whether it's reading a book, whether it's listening to music, whatever works for you. We've just covered a few methods, and there's so many others that can be used. And some may work for some, but like we said, some may not work for others. So make sure you find the best solution to combat the stress of intense exercise to generate better results that works for you. And then be proactive. Stress the importance of periodization. And what we're really hitting on is that rest period. Because remember, rest is not a bad four-letter word if it's done correctly. So make sure you include planned recovery weeks into your client or your athlete sessions. It does not mean no workouts. It may mean that they do a lighter workout where maybe they're working on technique instead or working on posture improvements, focusing on mobility, focusing on areas of weakness. What we're saying is they don't have to work at 200% every single day because after a while your body is just going to bottom out from that. Educate your clients. Talk about recovery techniques. Recovery techniques typically occur outside the gym. So give them some methods, give them some ideas of things to try. Give them the tools that they need to understand how to take better care of themselves at home or at work. Because remember, we only see them for an hour a day, maybe 2-3 days a week. So that hour in that one day, what are they doing the other 23 hours in their day? That's what they've got to control. And never underestimate that power of sleep and the power of nutrition and the power of rest. And really emphasize that to your clients and your athletes. So you have finished your webinar, and I hope you stayed awake through the whole thing. So here is the information from the slide that I showed you at the beginning. As promised, it's here at the end. You have completed your webinar, so we can check that one off. So if you're near a printer, of course, make sure it's on. What you're going to do is log into the Exercise Etc. website at exerciseetc.com. You're going to click on Administration. Then you're going to click on the Webinar On Demand Certificates, and you're going to complete all the required fields the way that you want to see it on your certificate. So make sure everything's spelled correctly and all that good stuff. And then once you're done with that, click Submit. You will get to see your certificate on the screen, so you can either save it if you're not near a printer and print it off later, or go ahead and print it off. And again, remember that if you fast forwarded through the program or left or, whatever, you may be denied your continuing education. So hopefully you listened to this whole thing, and hopefully you got some positive things out to help yourself. So thank you for listening, and I hope to talk to you later. in another session.